Okay, so now I'm gonna be looking at your breathing and also listening to your lung sounds. So if you can cross your arm across your chest like this, I'm just gonna be assessing your breathing.
Okay.
So your breathing is regular. It's not shallow and it's not deep, and your rhythm is normal as well. Non-labored with no usage of accessory muscles. So now I'm gonna listen to your lung sounds. So I'll be listening in 8 places. So here, 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 and here.
Okay.
Same thing in the back, and then twice here on the sides.
Okay.
So whenever I place the stethoscope on you, just take a breath.
Okay.
And a couple more. Okay, now I'm gonna check same areas just in your back.
Okay.
Twice here. And 2 more here. Okay. So your lung sounds are good. There's no sound of rhonchi, wheezing, or stridor, or pleural rub, which is good. And breathing seems non-labored. So what I'm gonna do now is I'm gonna listen to your bowel sounds. So I'll be listening in the right upper quadrant, left upper quadrant, left lower, and right lower. And then afterwards I'll be palpating.
Okay.
So bowel sounds seem normal. They're within range of 5 to 35 per minute. So now I'm gonna palpate your abdomen. So let me know if there's any pain, tenderness, or guarding. Okay. So any pain? Nothing? No?
No.
Okay. So I would check for the presence of a stoma. And then I would ask questions to the patient. So when was your last bowel movement?
Last night.
Last night. And how often do you have a bowel movement?
Once a day.
Once a day, okay. So now I'm gonna be palpating your bladder.
Okay.
So I'll be checking for any distension, fullness, or tenderness.
Okay.
have any pain or any tenderness? No.
Nope.
Okay. And then a few questions. How often do you urinate a day?
Probably 8 times.
8 times. Okay. And can you describe the color of the urine?
Pretty clear, slightly yellow.
Okay. And is there any odor with the urine?
No.
Any burning or pain when you urinate?
None.
Okay. And I would also check for the presence of a Foley catheter, nephrostomy, or suprapubic catheter. So what we're gonna do now is just check your range of motion.
Okay.
So I'm gonna check shoulder movement, elbow, and wrist, and then we'll do hip, knee, and then ankle.
Okay.
So if you can just do what I do. So
Okay.
can you raise up your hands like this? Good. Now can you do this here? And can you move your wrist?
Yep.
And for coordination, can you do this with your fingers? Perfect. So what you'll do now, you're gonna pull towards you, and I'll be pulling towards me.
Okay.
Okay, good. Now push towards me. Okay, so strength is equal bilaterally. So we're gonna do the same thing with your legs.
Okay.
So are you able to, one at a time, lift up your leg?
Yep.
Straight like that. And now your other leg. Good. And now can you move your ankle? Now the other one. Good. And same thing, so what you'll be doing now, with your feet, you're gonna be pulling towards you.
Okay.
Perfect. Now the other way. Okay. So I'll be checking for coordination, strength, and also any pain and any bruising as well in the joints. So now I'll be checking your skin. So if I can look at your fingernails here. So I'm gonna check for capillary refill. And capillary refill is under a second. Patient seems warm to the touch. And the condition of the nails seem good. They seem nice and trimmed. And there's no bruising in the hands. Same thing with your feet. Capillary refill is good. I see no pain or any redness in the area. So I would assess the skin as well in the back. I would check for any redness. I would check for the temperature as well. So patient is warm to the touch. There's no redness. I think that's it. I think we're done with the physical assessment.
Wow. Thank
Yeah,
you.
No problem.